Are you allowed to brush your teeth or not? Pain after dental implant surgery. Swelling after dental implant surgery. Please avoid using a straw. Dental implant surgery. I'm going to provide a perspective from a dentist on the do's and don'ts of your diet. First and foremost is avoid chewy foods. So eat food that's very easy to chew and swallow, not hard foods or very stiff bread or any food that requires considerable amount of chewing. Secondly, eat nutritious food such as fruits, vegetables, lean meat, and healthy fats. Thirdly, avoid eating hot foods. Hot food can actually disrupt the healing side. Enjoy your meals, but in a smaller meal sizes. Do not eat like a huge meal following your implant surgery. Please avoid using a straw. I need to explain what happens when you use a straw and how is that related to the implant side or even the tooth removal side. Whenever you use a straw, there's something called as a sucking motion or sucking mechanism, right? You're sucking the liquid from the straw, but also the implant side is having something called as a clot that's helping it to heal, right? Especially if the place had been sutured or if there was a cut that's healing. Dental implant surgery and rinsing. Do not rinse for at least 24 hours following dental implant surgery. And the reason being, when you vigorously rinse your mouth, you're going to potentially disrupt the healing process that's happening on the implant side. And that happens by dislodging the clot that's forming at the implant side or even the tooth removal side. In addition to this, the vigorous rinsing may actually open the healing wound as well. So it's very important to not rinse. So what can you do if there's either saliva that accumulates or fluid inside your mouth? You can take some clean tissues from the outside and you dip your head and then you wipe all this excess fluid from the outside. But make sure do not touch or contaminate the implant side by any means. So I'm going to explain to you how to reduce the swelling and why does the swelling happen in the first place. First, why does the swelling even happen? That is a natural, biologic, physiological response from your body to the surgery that happened. Swelling also can occur after tooth removal. This is completely normal as long as it's not a gigantic swelling. Now, normally the swelling does subside over time and it gradually reduces. If it doesn't, then make sure to contact your attending dentist or physician. How to reduce the swelling is by cold application. Cold application reduces swelling by constricting the blood vessels on the swelling side and reducing this increased flow to it. So you can use ice packs for 20 minutes on and off. You need to allow the area to heat up a little bit after you use the cold because you also want the blood flow to go back into there again. Pain after dental implant surgery. It's completely normal to experience mild to moderate pain after dental implant surgery. The degree of pain depends on how traumatic the procedure was, in addition to how many procedures were done at the implant site, meaning if there was also a bone graft that was done and any additional procedures that where necessary, if they were done, that will potentially increase the pain that you're feeling. Now, how to manage this pain is simply to take your prescribed medications. And if this pain does not subside and only increase and doesn't decrease over time, then make sure to contact your attending dentist or oral surgeon or specialist who did the dental implant. But it's completely normal to have pain after dental implant surgery. Exercise and dental implant surgery. For the first few days to a week, please avoid strenuous exercise. And the rationale is you want to allow your body to rest and heal. This is not the time to go for a deadlift PR. However, after let's say like a week from dental implant surgery, I do actually encourage a mild like walk, just get the like blood flow in your system if you're feeling well, but please do not do any like aggressive lifts or sprints or any sort of vigorous activity. You want to rest and let your implant side heal. Dental implant surgery and brushing your teeth or oral hygiene in general. Yes, you have just had this implant surgery done. Well, what about keeping your mouth clean? Are you allowed to brush your teeth or not? So let's say in an instance where you had your dental implant surgery in the morning, and let's say right now it's evening or nighttime, you can actually and you are encouraged to brush your teeth. However, please take precaution to not brush, do not brush the implant side, as that may disrupt the healing. However, it is very important to keep a clean mouth. That will reduce the chance of potential infection, because you do not want mouth full of bacteria and plaque while a dental implant is healing. However, make sure to not rinse. Okay, so what you want to do is whenever there is like a foam from the brushing or excess saliva, just tip your head over and allow this saliva and all of this to come out, but do not rinse or spit. That may also disrupt the healing process by either opening the surgical site or by dislodging the blood clot. Dental implants and smoking. What's the deal here? I mean, the no-brainer is avoid smoking, but for how long? Well, ideally you want to avoid smoking for at least 7 days following dental implant surgery. And the rationale is the toxins included in this smoking device, let it be a regular cigarette or like tobacco or the vaping, all of these things, they include toxins. They may increase the likelihood and potential for infection at the implant site and delaying the healing. Also, keep in mind that most smoking vehicles, devices, and material, they include nicotine. And guess what nicotine does? Nicotine is a vasoconstrictor. Vasoconstrictor means it acts to, you have your blood vessels that are having the blood flow to the implant site. A vasoconstrictor narrows these blood vessels, so even further delaying your wound healing. And just imagine if you're constantly having that smoke going through the healing site, you're just delaying the healing more and more, and you're increasing the likelihood for infection. Dental implant surgery and your lips. Please avoid pulling your lips around to check the dental implant site. Reason being, this may actually disrupt the healing process. It may either open the wound site, it may also lead to the disruption of the sutures, if any were used, and also do not touch the implant site with your fingers, as this may increase the likelihood for contamination and the potential delaying of the healing and even the infection of the implant site. In addition to this, please avoid biting on the inside of your lip. And the reason being, depending on where the implant was done, it will take some time for the anesthetic to wear off. So you may not feel that you're really biting on your lip for a long period of time. Just to know, when the anesthetic wear off, you're gonna have a lot of pain and swelling in the area where you have been biting, but you didn't feel it before because that region was anesthetized. So I wish you a good recovery.